auspicious beginning of today's conference and awards ceremony, we now proceed with the traditional lamp lighting ceremony. And I would like to invite on the stage Dr. Farheen Khan, co-founder and CFO of Golden Aim Conference and Awards, Ms. Farheen Syed, Director of Golden Aim Conference and Awards, Mr. Azharuddin Farooqi, CEO of Dynergic Business Solutions, Dr. Khusrav Bhajan, Colonel Dr. Madhumita Dhal, and Dr. Usha Sharma on the stage for the lamp lighting ceremony. Thank you so much, sir and ma'am. Please have a seat. Once again, a very good afternoon, ladies and gentlemen, esteemed guests and participants. It is my sincere pleasure to welcome you all to the Golden Aim National Conference and Awards for Excellence and Leadership in Healthcare. My name is Megha Kedia and I'll be your host for this prestigious event. Today, we gather to celebrate excellence and leadership in the healthcare sector and segments. This occasion represents a unique opportunity for all of us, whether we are industry veterans, budding entrepreneurs, or aspiring professionals, to enrich our knowledge and gain insights from one another. The Golden Aim stands as a beacon of prestige, recognizing and rewarding exemplary achievements and leadership in different fields. These awards, established by Golden Aim, provide a vital platform to honor the extraordinary contributions made by the healthcare, pharma, and business professionals who have significantly advanced the growth and development of their respective industries across the nation. The Golden Aim presents National Conference and Awards Excellence and Leadership in Healthcare is the culmination of extensive and meticulous research conducted by a dedicated team of postgraduate researchers specializing in healthcare management. This team, which has over 15 years of cumulative research experience, is committed to identifying and recognizing the most deserving individuals in the industry. They have worked tirelessly to ensure that we honor those who have demonstrated exceptional achievements and made significant impacts in their fields. And as we proceed with today's program, we are excited to present a lineup of renowned leaders from the industry who are celebrated for their dedication to outstanding leadership. I would like to request Dr. Farheen Khan ma'am to come on stage and share the introduction speech with us. Please give her a huge round of applause. I have kept the
Good afternoon, ladies and gentlemen. This is Dr. Farheen Khan, co-founder and CFO of Golden Aim, Chairperson Asia GCC Award. I would welcome you all to all the speakers and other guests for gracing this occasion. I would like to take this opportunity to extend a welcome to all the guest speakers who are present with us today. I would also like to thank to all the prominent leaders from the education and healthcare fraternity for being here and make this event glorious with your glorious presence. I also welcome to the glad winner of 15th edition. This is the 15th edition we are conducting the Healthcare Award ceremony. And yes, ladies and gentlemen, you all are the leaders and you all are the achievers. And you have proved to be a role model of thousands of people across the globe. And today, we are going to celebrate your achievement. Today, we are going to acknowledge your achievement. Before we go ahead, let me tell you about Golden Aim. The word AIM stands for Achievement, Innovation and Motivation. It is one of the Asia's leading brand building firm. And when we talk about the award legacy, it has been globally recognized by all the prominent leaders. And it's a very important how we select you. So we have a very team that is an intellectual and interesting team who do analyze and research. And after a final presentation, the winners are born. So let's put a round of applause for you people around who have been with us today. Going ahead, I'm very excited to see and hear all the leaders with us today. Once again, welcome you all to the Golden Aim Conference and Award for Excellence in Leadership in Education and Healthcare. Thank you, everyone.
Thank you so much, ma'am. Moving to our panel discussion, I would like to call upon stage Dr. Khusrav Bajan, Consultant PD, Hinduja National Hospital, Mumbai.
First of all, I would really thank the organizers for calling us and inviting us and having such an amazing program. So I'm very glad to be part of that. And yes, technology and excellence is here to stay. And the next few years are definitely going to see a boom in the technology that we are going to face as healthcare professionals. So keeping the theme in mind, I actually thought of giving a heading or a topic title, The Good, the Bad and the Ugly of AI in Healthcare. So this is what, am I audible at the back? Yeah, sorry, I have to keep walking because of this. So what is the good of AI in the current day and age and the future? It all began with John McCarthy, who is the father of artificial intelligence. And the definition here is that the computers and the technology are made to simulate intelligent behavior, critical thinking, comparing or comparable to the human mind. So it is not something which is going to outgrow the humans, but it is something which is actually replicating and trying to be better than the human mind. So it is very, very essential for us to know that that was the definition of artificial intelligence when it came into being by John McCarthy. Ever since, if you look at the healthcare scenario, medical intelligence from imaging in 2010 till 2023, it's got predictive analysis, robotic surgeries, AI-driven administration, virtual health assistance, and the list goes on. And that makes AI probably a game changer, pretty revolutionary, compelling, because it reduces the diagnostic errors by 85%. It also streamlines administration by 20% and personalizes treatment and reduces mortality by 30 to 40%, which is a huge game changer. So the good part is that it can be utilized by the doctors in a very big array of technology in treating patients, especially in the critical care where I belong. So it has improved diagnostics. You can diagnose by radiologically, dermatologically, pathologically, so many other ways that you can actually improve upon this. Personalized treatment, drug discovery development, enhanced operations, robotic surgeries, patient monitoring, and fraud detection can all be helping the doctors and the healthcare in actually doing a better job. So these are the common advantages which I have said: early diagnosis, monitoring, reduction in errors. But I would like to point out a few others, like a burnout reduction. We all in the healthcare profession do have a burnout very soon, and those of us who have worked for 20, 30 years already are facing some burnout. And I think this is very important, because this is not going to pose a problem to you, but it's going to help you and aid you in your management. Telemedicine, hub and spoke model can also be done, and simulation-based training. They can actually make a digital twin out of you, so the patient will be mimicked in the form of a digital twin, and then you can actually understand what the response of the patient's physiology would be by not adding problems to the patient, but working on the digital twin and knowing what the response would be. Precision and personalized medicine, data and research, and the whole concept is going to be proactive rather than reactive, and that's what is important. And you have a bunch of things here which actually tell you 30% reduction, 35% reduction in medical errors, and this is backed by data. This is again a whole array of technologies where you can do awareness, training, settings, clinical applications, etc. with the good part of the AI in healthcare. So is there a bad and an ugly? Yes, there is plenty of bad and ugly, and we need to understand all this. And it can be a data bias or even privacy. We are always worried about privacy issues, unemployment. Are we doctors going to stand here even after 10, 20 years more? Or are we going to be replaced, and is this Golden AIM award going to go to only robotics? Plus lack of personalized feedback, ethical issues, and many, many more can be addressed as the bad and the ugly. I just have pointed out a few bad ones here. AI is also known to have a black box. What it understands is it gives an input, and depending upon the input, it gives you an output. And what it does in between the input and output is a black box to the user or all of us. But you can circumvent this by a certain layering of the technology in which you can actually have a explainability era and try to take care of the black box. I'll give you a very silly and sweet example of, suppose I had to take a talk on COVID and I typed in the prompt, I asked Copilot or ChatGPT or even Google Gemini to type SARI, S-A-R-I, we all know that. And what do I get? I get this. So I have not put an input, I'm a doctor. I have not put an input that I need to speak to people on COVID, and therefore instead of severe acute respiratory infections, I get a SARI. And we all know that in AI, the word Python means a lot. So the Python got confused and it gave me a Pythani SARI. Sorry for this bad one, but just trying to make you understand how a wrong input can give you a wrong output, and then that can be a bad thing with an AI. Also, like we humans love to hallucinate, the AI is also supposed to be hallucinating, and that's because of the large language models which have an incorrect output because of all the other reasons mentioned. But there are technologies which can, or steps which can help in even reducing this hallucination from the AI, and the most important is the number 2, which is human oversight. So what is the ugly? I told you the bad, the good. Now let's look at the ugly part of the AI. There is lack of humanization and empathy. So every patient needs a human touch, they need empathy, they need good communication skills. That would be lacking from coming from a computer. You can't tell a dying patient or the relatives that, oh, the Google or the AI has told me to do this to you, so I'm just following orders. So you need to have the human touch behind the machine and also with the patient. But AI is progressing every day as we talk, and they are coming up with an empathetic AI where they are going to mimic the emotions of the doctors, the patients, etc. Take away our jobs. This is the question all the time asked by us, and Elon Musk, I think, just recently announced that there's no need of going to a medical college, and all my robots will take care of all the patients in surgery. That's scary and it is stupid, but what you can do is embrace the technology rather than resisting it and make a hybrid model. We love hybrid cars, right? Similarly, have a hybrid model in which you have artificial intelligence, your clinical expertise, and both together will have a hybrid intelligence. So my take here is AI will surely not replace doctors, but AI will replace those doctors who do not embrace the technology and move further. Also, the ugly parts are privacy concerns, as I mentioned, the algorithm bias, the deep fake, and the misinformation. We saw so much misinformation during COVID times. Vaccines are bad, this is bad, you do some other stuff of medicines and so on and so forth. So I end here, my friends, by saying that when we doctors and AI work in sync, we will provide precision and personalized medicine to our patients and get a much better outcome. And with greater power comes greater responsibilities, and this was told to Spider-Man by Uncle Ben, and I think we all need to understand how we can provide ourselves with more armamentarium and get better and better. So I do not like calling it artificial intelligence. When we use the word artificial, half the enthusiasm is gone. I call it assisted intelligence, or I call it augmented intelligence, where we are the masters of the control. Just the last poem, it takes 10 seconds. In the ICUs where monitors beep and glow, AI makes algorithms for us to know. It reads the data points, the scans and the chart, finding patterns where we fear to start. Not to replace the human touch or care, but to augment and assist the hands that are already there. Thank you, my friends. And this is going to be the AI of the future. And today we are standing here with the same theme, digitalization and innovation in healthcare. Thank you all. Sorry to take so much of your time.
Giving the panel discussion a little pause, we'll quickly move towards the award part. And the first category is the most trusted orthopedic and spine surgeon in West Bengal. And the award goes to Professor Dr. Ujjwal K. Debnath, Consultant Orthopedic and Spine Surgeon, Ventura Wellness Clinic, Kolkata and Operation, Straight Spine Trust, Kolkata. And to give away the award, I would like to call upon stage Mr. Azharuddin Farooqi sir and Dr. Khusrav Bhajan sir. Please give them a huge round of applause, everyone. This is a special award presented by Mr. Farooqi sir and Mr. Bhajan sir to Mr. Ujjwal K. Debnath sir. तालियां बजती रहनी चाहिए, everyone. Come on. Thank you so much. I would like to request sir to say a few words.
It was a surprise 2 weeks ago when I received this email as well as a WhatsApp message regarding this award. I was completely awestruck. So how can I go to Mumbai and do this? But at the same time, I was supposed to be in Pune on 22nd, 23rd, 24th for a National Spine Congress where I was a panelist and a speaker. So I took time off from there. This morning I drove down from Pune here to attend this meeting, and I have a flight at 5 o'clock. So I said, if you can organize the award to be given early, so I would be able to catch my flight to Kolkata. And it's a great honor to be here, and I thank Golden Aim to have chosen me for this prestigious award. And I would like to say a few words regarding the healthcare system, which is changing rapidly. And I have been in England for 20 years and India for the last 15 years. And I've been practicing in Calcutta, which has given me innermost sense of well-being for my patients who have been taking care, as well as with a lot of advanced technology, which we had the skills to learn from abroad. I could give this to my people, and I'm very much honored to be a part of this country and support my patients and everyone. And I was also honored in November by Times of India as the Excellence Award like this on 26th of November. So thank you very much once again, and I'm glad, and enjoy your whole day, and thank you. Thank you.
Thank you so much, sir, and many congratulations. Now again, moving towards our panel discussion, and the topic would be the importance of innovation and digitalization in today's era, healthcare. I would like to call upon stage Colonel Dr. Madhumita Dhal ma'am, Director of Nursing, Rajiv Gandhi Cancer Institute and Research Center, Delhi. With Dr. Kusrav Bhajan sir, consultant PD Hinduja National Hospital, Mumbai, and Dr. Usha Sharma, medical superintendent, KB Baba Hospital, Mumbai. I'd like to request the team to arrange the chairs on the stage.
नहीं नहीं नहीं
Yeah. Okay, no problem. You can sit here, and one by one you can come to the podium, or you can just take the mic, whatever you like. You can start from there, wherever you're comfortable.
So a very good afternoon, one and all sitting here. And before I start, I would like to thank the organizing team for inviting me for this panel discussion. And being a nurse, I'm from a nursing background. So being a nurse, it's really a challenge, to understand the innovations and the digitalizations and the importance in patient care. So I strongly believe that digitalization, yes, and innovation helps us to reduce the burnout of the staffs, the nursing staffs, helps in workforce, helps to combat the workforce shortages, and overall improves the patient outcome. Sir has already spoken about the AI. What I would like to put in forward is the innovations that has actually bring changes in the patient care. The first mode we all know is, when we talk about patient care, we talk about patient safety and how we can make our patients safe, because we as a nurse are there 24/7 at the patient's bedside. So there is one digital medication management system, that is BCMA. Majority of the hospitals are having this BCMA, where the medications are barcoded, and thus it prevents your medication administration error. You cannot put, if a particular medicine has been intended for a patient and the medicine is barcoded, that medicine will be only given to that particular patient, and that medicine cannot be, by mistake, cannot be given to any other patient. So thus it helps in medicine administration, prevents medication administration error, and helps in giving right drug to the right patient and right dose. Then we have smart infusion pumps. And being in cancer hospital, we deal with chemotherapies, we give chemotherapy drugs to our patients. So, the drug, the dose, everything matters, even the drop factor matters. So we ensure that the chemo drugs are transfused with the help of all smart infusion pumps in our institution. So these smart infusion pumps have their own drug libraries. You can customize the drug libraries, and they help in delivering the precise dose to the patient, and thus again prevents medication error. Then we have portable and wearable sensors. And as Sir said, patient monitoring system is there. In our hospital, we are using, you might be aware of dozy beds. So this is a patient monitoring system where a sensor is placed at the under the patient's mattress, and the patient's vital signs, ECG, oxygen saturation, everything is monitored on a central monitor. And as the patient-nurse ratio is in all the hospital is a point of concern. So when there is any changes in any of the vitals, any of the parameters, an alarm is there, and the nurses immediately is able to detect the variability in the vital signs, and appropriate action can be taken, and so that the patient is safe. Then obviously EMR, almost all the hospitals are practicing EMR now. EMR is mandatory, is required in almost all the hospitals. In our hospital also we are practicing EMR. So it standardizes the documentation, it prevents documentation error. When manually we try to document anything, chances of error will be there. Bad handwriting can also be one of the factors. So EMR is there, which helps in, preventing documentation error, and also being in the EMR, the complete entire medical team is able to see the patient's information, and everything is available to the patient, to the complete team, and the nurses get enough time, more time towards the patient's bedside. Then we have safety cannulas. Safety cannulas is, we prefer and we use safety cannulas in our organization because it prevents your needle stick injury, it prevents infection, it prevents the backflow of the blood, and prevents blood spillage also. So these are the various innovations. And as Sir said, simulation, yes, simulation training, as per the Indian Nursing Council, Indian Nursing Council has given a mandatory to all the colleges of nursing that the nursing colleges should have simulation labs where the student nurses will be practicing the complex procedures and all, and improve their decision making before they come as a staff nurse and come to the patient contact directly. Then another thing coming up is your telehealth nursing. Apollo and Reliance Foundation is promoting this telehealth nursing very actively, because this telehealth nursing is actually, you are able to reach the patients in the remote areas, and mostly we are concentrating on, we have also started telehealth nursing, and it is concentrating on the rehabilitation part, and also pre and post-operative care, and a follow-up care of the patients who cannot come to the hospital on regular intervals. So everything, whether it is digitalization or innovation, everything has its plus and minus points. The only thing what I feel is that yes, things are changing, and as a nurse, we should adapt to the technology at the earliest, and simultaneously we should not forget the tender touch that we are supposed to give to our patients. Thank you very much.
Thank you so much, ma'am. And moving towards our next speaker, I would like to call upon Dr. Usha Sharma, ma'am, Medical Superintendent, KB Baba Hospital, Mumbai. Ma'am, please come.
Respected dignitaries, colleagues and friends, good afternoon. I would like to thank committee members of Golden Aim Awards for inviting me to speak on the importance of healthcare in digitalization and innovation in today's era. Healthcare is no longer confined to hospitals, clinics and laboratories. It has entered our homes, mobile phones and even our daily routines, driven by rapid digitalization and innovation. Why digitalization in healthcare is no longer optional? Healthcare systems across the world are facing multiple challenges: rising burden of non-communicable diseases, increasing aging population, shortage of healthcare professionals, rising cost of treatment, unequal access to quality healthcare especially in rural and remote areas. Digitalization is not a luxury, it is necessity to address these challenges. Technology helps us to deliver care that is faster, safer, more accessible, and more affordable. Digital transformation of healthcare. Digital healthcare refers to the use of information technology, data, and digital tools to improve health outcomes. Some key components are electronic health records. Paper files are being replaced by digital health records. Enables continuity of care, reduces duplication of tests, improves decision making, and saves time for doctors and patients. A patient's medical history can now be accessed anytime, anywhere, improving emergency care and referrals. Telemedicine and consultation. One of the biggest breakthrough, especially during COVID-19. Patients can consult doctors from home, useful for elderly, disabled, and rural population. Improves follow-ups and continuity of care. Telemedicine has transformed healthcare from being hospital-centric to patient-centric. Mobile health and apps. Smartphones have become powerful health tools like appointment booking, medication reminders, fitness and lifestyle tracking, mental health support, chronic disease monitoring. Healthcare is literally in the palms of our hands. Digital supply chain and hospital system, inventory management, e-pharmacy, then bed management and real-time dashboards. Innovation in health technologies. Innovation is driving healthcare beyond traditional boundaries, artificial intelligence and machine automation. Machine learning. AI is transforming radiology and imaging interpretation, early disease detection, predictive analysis, and clinical decision support. AI does not replace doctors, it supports doctors by improving accuracy and efficiency. Wearable devices and remote monitoring, smartwatches, and medical devices can track heart rate, blood pressure, blood sugars, oxygen saturation, and sleep patterns. These allow early detection of abnormalities, reduces hospital admission through continuous monitoring. Robotic and automation. Robotic surgeries improve precision. Automation in laboratories reduces errors, improves safety for healthcare workers. Innovation enhances both quality and safety of care. Digitalization in public health and preventive care. Digital tools play a crucial role in disease surveillance, outbreak detection, immunization tracking, health education, population health management. In India, Digital Health Initiative helps in large-scale data analysis, targeted interventions, and monitoring national health programs. Digitalization strengthens preventive and promotive healthcare, reducing long-term disease burden. Patient-centric and value-based care. Digital innovation shifts healthcare from treatment-focused to preventive-focused, doctor-centric to patient-centric, volume-based to value-based care. Patients today are more informed, more involved in decision-making, active partners in their health journey. This empowerment improves compliance, satisfaction, and outcomes. Challenges in digital healthcare. While digitalization offers immense benefits, challenges remain, like data privacy and cybersecurity, digital literacy gap, infrastructure limitations, ethical use of AI. Hence, digital health must be implemented with strong regulations, ethical framework, training of healthcare professionals, patient awareness. Role of healthcare professional. In this digital era, healthcare professionals must adapt to new technologies, upskill continuously, maintain empathy and human touch. Use technology as a tool, not a replacement for compassion. Technology enhances care, but human value remains irreplaceable. The future of digital healthcare. The future will see personalized medicine, genomic-based treatment, predictive and preventive healthcare, integrated digital health ecosystem. Through Ayushman Bharat digital system, Abha ID will be created, health facility register and health professional registry. This allows portability of health records across states and provides us a major game changer for public health. Healthcare will become more proactive than reactive. To conclude, digitalization and innovation are reshaping healthcare of India by making it, and world over, and making it more accessible, more efficient, more patient-centered, more sustainable. In today's era, the importance of healthcare digitalization lies not just in technology, but in its power to save lives, improve quality of life, and ensure health equity. Let us embrace digital innovation while preserving the core values of healthcare: care, compassion, and commitment. Thank you.
Thank you so much, ma'am, for your words. Now, I would like to request Khushrav sir if he wants to say something or add something to the topic.
I already spoke, and thanks for allowing me to go first, because ma'am had even better views. And I think what we are here today to understand is, first and foremost, thanks for the Golden Aim to bring us together. It's a very nice forum that it's not only giving away prizes, but it has got a theme, and the theme is that how do we take the next 10, 20 years of the future into healthcare. And we need to understand that whenever there is an upgrade in technology, upgrade in any of the infrastructure, we as doctors, nurses, caregivers should embrace it for the betterment of the human being. So I think this is a very good forum, and there'll be many, many more forums where we need to understand that if we don't know a technology, we have to embrace it, learn it, understand the good and bad of it. Not just every new technology, every new ventilator, every new machine is going to come with only good. So please dissect it out, criticize it, try it out, and only then base your decision. So I think we are very proud to be part of this forum today, and thank you everyone. Yeah.
Thank you so much, sir. So, anyone, if you have any questions for any of the three? Any questions, anyone?
It's supposed to be a panel, but we thought we just express our viewpoint. Thank you.
All right, thank you so much. But, sir, please once again stay on the stage, be on the stage. I would like to request Dr. Fareen Khan, ma'am, Ms. Fareen Syed ma'am, and Mr. Azharuddin Farooqi sir to present thank you memento to all our three leaders. Please remove the chairs from the stage. Such a sweet gesture. All of you, please pause for a group picture. A happy group picture, please. Thank you so much. Please have a seat. All right. ठीक है. All right, without further delay, let us proceed to the highly anticipated awards ceremony to recognize and celebrate the exceptional accomplishments of our honorees. Each award signifies not only individual achievements but also serves as an inspiration for all of us to pursue excellence in our respective fields. Now, to give away a few set of awards, I would like to call upon stage Dr. Fareen Khan ma'am and Mr. Azharuddin Farooqi sir. Please give them a huge round of applause. The first category that we have is Outstanding Contribution in the Field of Healthcare, and the award goes to Colonel Madhumita Dhal ma'am, retired, Director of Nursing, Rajiv Gandhi Cancer Institute and Research Center, Delhi. Please keep the applaud going. I would like to request ma'am to say a few words.
A very good afternoon. Actually, I'm overwhelmed. I had done my nursing from Armed Forces Medical College, Pune, and I was commissioned into Indian Army, and I had served Indian Army for 23 years plus. So during my Indian Army tenure, I had been posted to various places starting from J&K to Nagaland. I have seen insurgencies, I have seen casualties. So the path was not very easy. And I'm really thankful to the organizing team for recognizing this. I strongly believe that anything and everything is possible in life if you are determined. And that is what is today I'm representing the nursing fraternity out here. And I would like to thank my family members who had always been a strong support for me during my tenure in army also, because we had long duties, we had long nights and all, and I had two small kids, and my husband was always there at my side. He's also from army. And I had great support from my team members. My team members are incredibly, they are very good team, nursing team I have in Rajiv Gandhi. I have a very supporting seniors in our organization. Our CEO, sir, he is very supportive for the nurses. Mr. D.S. Negi, he is a retired IS officer. And our medical director, sir, Dr. Sudhir Raval, he is also very supportive for the nurses. And the trust that he has, that is how I am able to achieve today what I am. That is why I'm standing here and being recognized for this. So I'm very much thankful once again to all my mentors, to all my peer groups, my friends, for all the things, for all the support they have rendered in my career. And this is not the end. I always believe there is never a full stop to anything. We must always strive to be more, grow in our career, grow in the things. And I always tell my nurses, whatever opportunity you get in your life, you must take it as a challenge, you must grab it and you must do it. Nursing empowerment is what I always believe, and I try to give to my nurses too. Thank you so much. Thank you so much.
Thank you so much, ma'am. Congratulations.
Thank you.
Yeah, no. Sir, you can have a seat and thank you. I would like to call upon stage Miss Usha Sharma ma'am to join Fareen ma'am on the stage to give away a few set of awards. Please join her. The next category that we have is Most Iconic Healthcare Personality Award, Biotechnology, and it goes to Dr. Pradeep Nagalkar, former Head Quality Control, Hufkeen Biopharmaceutical Limited. ये है क्या? Okay, yes. A big round of applause for this remarkable victory.
Good afternoon, everybody. I would like to thank Golden Conference and Awards for recognizing me for this award. I am in the industry from last 35 years, and this is my 10th award I am receiving today. That includes 2 Lifetime Achievement Awards also. I work in the vaccine industry. Basically, I am a scientist. I work as a scientist for 13 years. Then I went to manufacturing company where we manufacture various vaccines like polio, DPT group of vaccine, then anti-snake venom serum, various tablets and anti-seras. I was heading the department for last 24 years. Thank you.
Thank you so much, sir.
Thank you so much for coming.
Thank you so much, sir. The next category that we have is Most Influential Leader of the Year, Pharmaceutical, and the award goes to Mr. Vivek Dhudev, VP Quality. जोरदार तालियां हो जाए सर के लिए. Let's applaud everyone.
Good afternoon, everyone. First of all, many thanks to God and the organizing committee. And I thanks to all the participants who are here. And I would like to say many thanks to my family, my father, mother, my brother, my teachers, and my friends from the school fraternity or college fraternity and the business fraternity. My name is Vivek, and I'm in pharma industry. And I'm very happy to be here along with all those personnel who are prescribing the products which we manufacture. And since from 96 till date, until up to 60 years of my age, I'll be in the pharma industry. And I'm truly enjoying the pharma industry. We call this industry as a hope of business because whatever medicines we are manufacturing, you people are prescribing to the patients, and they feel that by use of these medicines, they got a chance to get better. So they got a hope. So I always say this is a hope of business. Regarding the artificial intelligence and digitalization, I really want to share that when I started my career in 96, we used to write a lot of things on the notebooks. Nothing has changed. The only thing is that despite of writing on the notebooks, now everything is coming from the computer. So I would like to say that regarding digitalization, if I see in dictionary, I don't have a word meaning as digitalization. I got as only digits. So there are only 10 digits from 0 to 9, but those digits through logarithm, help us to form the computers and to use the internet. As rightly said by doctor, I got a new definition of artificial intelligence as augmented intelligence. I want to say that intelligence cannot be artificial, or any artificial cannot be intelligent. So that is my view. My view is that there is a biological intelligence, or it's a natural intelligence, or I can say when I was in school, I was never considered an intelligent student. But my parents used to say, study hard, study much more. Then I realized that more study, more confusion. No study, no confusion.
Good one.
But yes, somewhere to become intelligent or declared intelligent by the fraternity, we have to score good marks. But yes, I feel that education is the thing by which we become more intelligent. And this is all because of education, that we use the digits into the digitalization, and that is now used as the artificial intelligence. So thank you very much to all of you for recognizing me and inviting me and giving me a chance to be along with you. Thank you, everyone, and God bless all of us. Thank you very much. God bless.
Thank you
God
so
bless.
much, sir. Congratulations. Thank you, sir. The next category that we have is Most Dynamic Healthcare Marketing Leader Award, and the award goes to Mr. Sumit Ramchandra Giri, Head Revenue Cycle Management, Lata Mangeshkar Hospital. Please give him a huge round of applause, everyone. Oh, he's with his little jam. The little leader in making. I would like to request sir to say a few words. Do you want to say something to Papa?
Congratulations.
Thank you, and thank you for recognizing me with these awards. Actually, मैं सबसे ज़्यादा थैंक्स मेरे बॉस को करना चाहता हूँ, डॉक्टर अनुज तिवारी सर, जो अभी यहाँ पे है नहीं, बट उन्होंने मुझे बहुत इनकरेज किया, एंड नाउ मैं भी ये पोजीशन पे हूँ कि मैं ये अवार्ड ले सकता हूँ. एंड थैंक यू फॉर गोल्डन एम्स.
Thank you so much, sir. The next category is Most Trusted Pediatrician and Neonatologist in Kolhapur, and the award goes to Dr. Vijay Kashinath Gavde, Neonatologist and Pediatrician, Sai Sparsh Children Hospital, Kolhapur, Maharashtra. I think he is not here, but we can still give him a huge round of applause. Moving forward, the next category is Most Trusted Orthopedic, ONCO and Spine Surgeon in Delhi, and the award, you were there? I'm a little fast, or maybe you're a little late. Okay, so all right. So the award goes to Dr. Hitesh Davar, Senior Consultant Orthopedic Oncosurgeon and Joint Reconstruction Specialist, Indraprastha Apollo Hospital, Delhi. सर से रहा नहीं गया. Let the applause continue, everyone. Thank you so much, sir. I would like to request sir to say a few words.
Many thanks to the organizers and the jury for kind of selecting me for this award. So I am an orthopedic onco and a spine tumor surgeon. I also work with the Apollo Corporate Office for the clinical quality and clinical strategy along with the Central Medical Services. We use this AI on a daily basis in so many things. So it's kind of just rushing back to me when Sir talked about it. So yeah, this is the future, really have to invest ourselves in it. And absolutely right, so those who do not kind of embrace it will, probably suffer with that. So yeah, many thanks to the organizers. Thank you so much.
Thank you, sir. The next category that we have is Most Trusted ENT and Skull-Based Surgeon in Mumbai, and the award goes to Dr. Neepa Velimuttam, Consultant ENT and Endoscopic Skull-Based Surgeon, SL Raheja Hospital and Wokhard Hospital, Mumbai. Keep applauding, don't stop. Thank you so much, ma'am. Please say something.
Thanks a lot to the organizing team. Very good conference and very nice turnout. I'm an ENT surgeon. My main focus is endoscopic skull-based surgery, and I practice in Mumbai, NSL Raheja Hospital, Mahim, and Wokhard Hospital, Mumbai Central. Once again, thanks a lot to the organizers for giving me this opportunity. I feel truly honored. Thank you.
Thank you, ma'am. The next category that we have is Most Renowned Healthcare Leadership Award Nutritionist, and the award goes to Dr. Zubeda Tumbi, Founder Director, Health Watch Nutrition Clinic. Thank you, ma'am. Please say a few words.
Thank you so much. And as I stand here, I feel honored and deeply humbled. The first month of the year 26, a powerful year, where I'm sure that a lot of people will achieve great things. But today I'm reminded of my first clinical case way back in the year 1989 when I set up Health Watch Nutrition Clinic. And I've often asked, nutrition clinic, you're going to be counseling patients. I said, yes. And I realized that nutrition, when you can make the person understand what his status is, metabolic status, and help him relate that to the kind of food that he's chosen to eat, the lifestyle that he's chosen to live, and what is the impact, the profound impact on his metabolic status. And then gradually, as we counsel them with compassion, clarity, make him understand. Because in today's time where there's overwhelming information available at every click of a button, the person fears a lot, knows too much, and doesn't understand what to choose as the right way to overcome the disease status. So I feel this award is for all those patients who believed in me, who connected with me, and who really understood the power of diet solutions for healthy living. And I would say that even today as I continue, I would want to reiterate that prevention is a priority, and good communication skills with nutrition understanding, with empathy, food can be the best way to resolve disease. Thank you so much.
What an incredible achievement. Congratulations, ma'am.
I will say that Dr. Farid is doing a incredible job. I mean, she makes it a point to, select people and choose them, and then she, makes you feel so good about your own work. So you want to come back with more hard work and compassion.
Definitely. You did so much.
Thank you.
Thank you so much, ma'am. Congratulations.
Thank you.
All right. The next category that we have is Most Trusted Emergency Medicine and Critical Care Specialist in Mumbai. And the award goes to Dr. Vijay De Silva, Director of Critical Care and Medical Director, White Lotus International Hospital, Navi Mumbai. I guess he's not here. Please give him a huge round of applause. The next award is Women Healthcare Leadership Award Nutritionist, and the award goes to Dr. Rekha Sachdev, founder, Dr. Rekha Sachdev. She's also not here. Moving forward, I would like to request both of you to please have a seat, and I would like to call upon stage Colonel Madhumita Dhal ma'am and Miss Farheen Syed ma'am, Miss Usha ma'am and Miss Farheen Khan ma'am. Please, thank you so much for doing the honors. Moving forward, the next category that we have is Most Trusted Bariatric and Hernia Surgeon in Mumbai. And the award goes to Dr. Brijesh Dubey, Consultant, Karuna Multispecialty Hospital and Surgery Center. Please give him a huge round of applause, everyone. I'd like to request Brijesh sir to speak a few words.
So, good evening, everyone. Thank you for this honor. Being most trusted, I guess it's a very humbling word. And because trust is one thing which patient gives us before even giving us a consent for surgery. So I would like to dedicate this to my teachers, my team, my colleagues, but most of all to my patients for trusting me. As we know, in surgery, it is not just about your technical skills. It is about your judgment, being honest, and doing the right thing for your patient even when it is the most difficult thing. Now, whether we do it with our natural intelligence or with help of artificial intelligence, it is totally up to us. But yes, I totally agree with the sir here who said AI is not going to replace the doctors, but yes, it will replace doctors who are not using AI. So that's it. And this makes me more committed to continue what I'm doing till now. Thank you.
This honor is absolutely well earned. Thank you so much, sir. Congratulations. The next category that we have is Most Dynamic Healthcare Leadership Award, Psychiatry, and the award goes to Dr. Darpan Kaur, founder and consultant psychiatrist, Sadhguru Mind Care and V Mind Mumbai. Excellence deserves applaud. Let's hear it, everyone.
Thank you very much to the organizers, and thank you Dr. Farheen Khan and Mr. Azruddin and the team of Golden Aim for awarding me this most dynamic leadership award in psychiatry. And it's the 15th edition of Golden Aim Conference and Awards for excellence and leadership in healthcare. So it's my very big honor. And I'd like to dedicate this award to the Almighty God, Vaheguru, to my mother, to my friends, my family, and patients. And speaking on the theme of today's conference is digitalization and innovation in healthcare. So some of my work with reference to psychiatry is that in 2025 January, I made a webinar presentation on technology and psychiatry and mental health at the WPA webinar series for leadership, and in my capacity as the elected leadership council member at the World Psychiatric Association of the CMCR section. And we also have the National Technology and Psychiatry Subcommittee, and I'm the co-chairperson of the Indian Psychiatric Society, and we've been conducting regular webinars, workshops on the theme of precision psychiatry, artificial intelligence in psychiatry, robotics and immersive technology, and also from the Indian Association of Private Psychiatry, we have started a task force on philanthropy and entrepreneurship in psychiatry, and we organized and launched a program, webinar series on Think Innovation. So a lot of this resonates, and last year I launched my second clinic, VMind, where digitalization and innovation is one of the key focus of VMind. So it's indeed my very big honor, and Dr. Fareen, a psychologist and mental health leader herself, it's a very big honor to come here, and I'm glad that the work that we are doing for advancing technology and the integration of technology, medicine, healthcare and psychiatry is getting appreciated at a forum. And more than it personally resonates with me that psychiatry sometimes may be stigmatized or undermined, but at this platform with very eminent surgeons, orthopedicians, physicians, that the field of psychiatry and mental health also gets its recognition. So thank you very much, all of you. Thanks once again.
Thank you so much, ma'am.
Heartfelt thanks.
Thank you, ma'am. The next category is most trusted radiologist and imaging specialist in India, and the award goes to Dr. Sona Ajit Pungavkar, radiologist, SDRC Fortis, Raheja Hospital, Mahim and Gleneagles Hospitals, Mumbai. A moment of pride. Let's applaud everyone. याद दिलाना पड़ता है बार बार. Thank you so much, ma'am. Please say a few words.
So thank you very much for this award from Golden Team. Thanks, both of you. Just to mention a little bit about AI, especially if I'm speaking after a psychiatrist. Way back, we started doing segmentation of the brain on the MRI to measure the hippocampus, and that led to the first surgical intervention for epileptic patients for lateralization at KEM Hospital. We did it for 100 patients. At that time, we were not aware we were working towards AI. Today, in my clinic, that gets automated. I get the report in like a few seconds. And at that time, I was the only radiologist who wanted to do the segmentation, and the rest of them didn't want to get involved. But that's the basis of AI, like Doctor said from Hinduja, that what the input is, we are going to get the output. So way back in 2004, I was also working on prostate segmentation. And now I realize that I was working with a team from US who was leading the research in AI. So what work you get to do as an imaging specialist has a wide spectrum. It's not only about looking at what the patient is suffering from, but also what is going to be the future. The AI future, I think, started with imaging, and then it's coming to the rest of the body parts, and especially in robotics, etc. So I'm very happy that I got to work on it. But having said that, I worked with Nanavati for 15 years and with Global Hospital for 8 to 10 years as head of Department of Imaging, and also in Kohinoor Hospital, which now has closed down. But I work with Raheja. I think there's one more colleague of mine from Raheja here for almost more than 15 years. So having had the academic background, I have more than 42 publications. I was working with Tata Hospital with the leading specialists, I think mentor of Dr. Davar here, Dr. Puri, and Dr. Jalali, who's right now leading the Proton Center in Chennai, Dr. Tejpal. So I've been very lucky and got to work with excellent people. That's where our mind has got shaped towards having a balance between a practice and academics and research. And we cannot dispute the fact that what a radiologist first puts out on paper is going to impact the management. So I do find that there is some shortcut approach right now in the imaging side because of the use of teleradiology and because of using technology. People like to sit behind the computer and not go out and meet the patient, which I think is not the right approach. So although we embrace technology, we must make sure that we are in the forefront talking to the patients and the clinicians. That's my message to the healthcare industry, that let not a radiologist just be in the computer room, and that the onus lies with the radiologist. It's not what the rest of the healthcare industry can do. But that's what I talk about in my message to the juniors in all my radiology conferences, that talk to the clinicians, talk to the patients. That's when you become a good radiologist and an imaging specialist. And I just want to end with that I dedicate this award to my husband, who's also a radiologist. He way back started his practice like 30 years ago in an ultra-suburban area of Virar because he didn't have any other option to earn money. He started from zero, and that was the first job he got, so he took it up. But he made sure that he gave very good service to that area and decided not to leave. So during my hospital practice, I also put up a center far away, and we, about 11 years ago, we were the first ones to give 24/7 service and help some patients with stroke in that area and trauma. And today, we have expanded to about 5 centers in the ultra-suburban area, where we do very good quality work. And we try to make sure that our patients do not have to repeat any scans, even in multi-speciality hospitals. So that is the future now, that as we reach out to the periphery and not focus just on the urban areas, but what we do outside the main centers is going to be the future of India, Indian healthcare also, and the Indian people and the Indian doctors also. When we say that there's no opportunity, there's a lot of opportunity outside the main centers, and we have to do the hard work and the sacrifice to make that happen. Thank you very much.
What a phenomenal journey to this.
Thank you very much.
Thank you so much, ma'am. The next category that we have is Most Trusted Healthcare Leadership Award, Psychiatry. And it goes to Dr. Chinmay Anand Deshpande, founder, Euthymia Psychological Wellness Center. I guess he's not here. Still, we can applaud him. The next category we have is Most Iconic Orthopedic Surgeon in Pune, and the award goes to Dr. Narayan Jivaji Karne. I guess he's not here, right? We can still give him a huge round of applause. The other category that we have is award for Most Iconic Personality in Homeopathy, and the award goes to Dr. Abhay Cheda, BMHS, CCAH, FCAH, PG, FHPC, Director, Department for MUHS, PG courses, the other song, International Academy of Advanced Homeopathy. Please give him a huge round of applause. This is a moment of pride. Let's applaud once again. Thank you so much. Please, sir, say a few words.
Thanks for the award to Golden Aim Conference and Awards team and the dignitaries present here. Being a homeopath, our mainstay is taking a detailed history, and in the history itself lies the cure. So that's one message as a homeopath I would like to give to all the doctors of all the systems, that something worth learning from homeopathy is the case taking, and it's like mirrors the whole issue, and by that the patient starts improving. So it's said that well taken case is half cure done, and further things is done by the medicine, which homeopathy is a large reservoir of medicine, about 5,000 plus medicines. We select from that as per the history. Now, on this basis, we have one academy called International Academy of Advanced Homeopathy, the other song. And here we have been teaching students after graduation into the best kind of homeopathy, and it's now the 12th year which has passed. And we also work with something called as time waiver, which is a German technology which analyzes from the patient's photograph, which we send at distance, and from that photograph, the machine gives you idea which parts of the person are working healthily, which are hyper-functioning, or which are hypo-functioning, and what possible diagnosis the person could be having. And also it suggests it gives the healing signals also from distance. So this is worth people, should use it very well. It's time waiver, German technology, and it can be used very well for intricate cases that we do already since last about 10 years. Thank you very much.
Thank you so much, sir, and congratulations. Thank you, sir. The other category that we have is Most Iconic Healthcare Leadership Award, Dermatology, and the award goes to Dr. Sadiq PM, dermatologist, Zaya Skin, Hair and Laser Clinic. Please give him a round of applause, everyone. Huge round of applause, everyone. मुझे लगता है चाय की ज़रूरत है. Congratulations, sir. I would like to request sir to say a few words.
Good evening, all. My sincere thanks to all jury members and entire Golden Aim Award team for this recognition. And I'm very thankful to my family, especially my father and my brother and my wife, for their continuous support and sacrifices. And as Sir said, AI is evolving very faster, and we have to embrace it. And as a dermatologist, we are started using it in diagnosis and as a part of treatment. And once again, thank you so much.
Thank you so much, sir. The next category that we have is Most Iconic Healthcare Leadership Award, Critical Care and Internal Medicine Specialist. And the award goes to Mr. Not So Busy Sir, Dr. Kushrav B. Vajan Sir, Consultant, PD Hinduja National Hospital, Mumbai. Sir, I would like to ask you to say a few words.
I'm sure you all are pretty tired listening to me, but I again express my gratitude for having stood here amongst everybody, and thank you for organizing this amazing workshop and conference. I have been in Hinduja Hospital as a critical care specialist and an emergency specialist and a physician since the last 32 years. And ever since, we've been dealing with life-threatening situations, and it's been my passion to teach. My mother has been a teacher. She's no more, but therefore I do definitely have teaching skills. And we've gone across the country teaching CPR and basic life support. So we have, empowered not only the medical fraternity, but even schools, colleges, the police, the NGOs, and done multiple trainings in CPR. We've also taught everybody in the act of first aid and emergency trauma care. So that's been my passion. And believe you, all of this is without the AI. So we are here to discuss technology. So please don't get intimidated by AI, which is there to stay. Let's integrate it within our practice, and nothing is there that you can't do without the AI, but it's just one part of the newer technology. So we need to embrace it, we need to move forward. But don't feel left out that, oh, I don't know about it, and then everyone is talking about this and you feel a bit left out. So don't get us wrong. It's not that AI treats patients, it is us who treats patients and us who actually are the fort holding the entire battalion to try and treat patients. Thank you very much for everything.
Thank you so much, sir. Madhumita ma'am and Farheen ma'am, thank you so much for doing the honors. You both can have a seat. Now to give away a few set of awards, I would like to call again on stage Kushrav sir for doing the honors, and the next category that we have is Most Trusted Healthcare Leadership Award in Pediatric Cardiac Surgery, and the award goes to Dr. Prabhatha Rashmi Murthy, HOD, Pediatric Cardiac Surgery, Shri Satya Sai Sanjeevani Center for Child Heart Care. Congratulations, ma'am. I'd like to request ma'am to say a few words.
Thank you, Golden Names, for this honor. I don't just see it as a personal achievement, but also as a recognition for the work that's being done for children with congenital heart disease. I just want to take a couple of minutes of your time and this platform to tell you about congenital heart disease, which contributes to about 30% of all defects that children are born with. And in our country and even globally, 9 to 11 children out of 1,000 are born with congenital heart disease. And in India alone, it takes the number to about 2.5 lakh children, of which sadly 25 to 30,000 alone get operated each year. So what comes between the children and healthy childhood is awareness and affordability. So I think we should spread the word that congenital heart disease is rampant. Children can be operated. Even in our country, we have success rates of 95 to 96% in most centers, and they can live near normal childhood and grow into healthy adults. Next is the affordability. Yes, heart surgeries cost a lot, but the current center or organization I work with, Satya Sai Sanjeevani, we've been doing all these services absolutely free of cost to children. And so far, about 40,000 children have been operated in our centers over the last decade. So,
what a well-deserved victory. Congratulations.
I think we all talk about right to speech, right to so many things, but there's no right to healthy childhood or right to health for a child, and they're generally voiceless. So request everyone here to pitch in to help children get operated for congenital heart disease. Thank you. I dedicate this award to my father, who's my inspiration, and thanks to everybody, family and outside, who has helped me to reach this and do what I'm doing today. Thank you.
Thank you so much, ma'am. Congratulations, ma'am. Thank you so much. Now I would like to call upon stage Mr. Ashruddin Farooqi sir to join Kushrav sir for the award giving ceremony. The next category that we have is Most Trusted Healthcare Leadership Award, Diabetology, and the award goes to Dr. Kamini D. Lakhinyani, endodiabetologist, Sadhana Proactive Clinic. I think she's not here. Okay, we can still have a huge round of applause for her. The other category is Women's Super Achiever Award, Neuroplasticity, and the award goes to Dr. Shweta Arora, neuroscientist, Evolve Your Brain. Okay, she's here with a little cutie. Give them both a huge round of applause, everyone. Someone is saying, छोटा कोई बच्चा कह रहा है ताली बजाओ ना, please clap for them. Do you want to say something, little princess?
Thank you.
Yeah, thank you, the organizers, and it's been a pleasure and I'm obliged to be a part of this award for the second year. I basically do work on neuroplasticity. I think we talked a lot about the AI. But I work little opposite to that, because now we have losing our, the way we read and the way we grab the things, we learn. Kids are mostly, involved in on the screen time. They love to, see a lot of, Instagrams and all these things. And world is moving towards different angle. But I try to make children, basically, I work on them and try to make them genius. And she's my little one, and she's all-rounded in everything. So few of the habits I adapted and trying to adapt in the kids so that they become genius. And at the end I say that are computer deleting us, or can we come out of that recycle bin? And I would like to thank my parents and God, Mahadev, who is my guru. Whatever he teaches to me, I go with that flow. And I try to make screens on my own on the clouds, and I try to write on the walls and try to adapt those habits among the kids and among the people, that they will also start becoming the upcoming Einsteins and as well as the Newtons. Thank you so much. Yeah.
Thank you so much. Congratulations, ma'am. The next category that we have is Best Principal and Medical Director Award 2026, and the award goes to Professor Dr. Sachin Kumar Sahib Rao Patil, Principal and Medical Director, Professor of HOD Department of Kaya Chiksita, ICU in charge, MAM, Sumati Bhai Shah Ayurved Mahavidyalay, Malwadi, Hadapsar, Pune. Please join me in applauding. I'd like to request sir to say a few words.
Good afternoon to everyone. I am Dr. Sachin Kumar Patil, working as a Principal and Medical Director of Sumati Shah Ayurved Mahavidyalay, Hadapsar, Pune. It is the great organization, Quality Control of India. There is a grading, A grade ranking from all over India, 700 colleges. The 30 rank is achieved. And from Maharashtra, the 8th rank, the college is achieved. And the NAC B grade, B plus grade also achieved. The college and hospitals are well functioning. There is a BAMS course, MD, MS in 14 branches, and PhD courses, diploma and fellowship courses also. Total number of students are 628. There is a highest ranking in our Ayurved field. Our hospital is dedicated to poor and needy people. They are serving to who has the cutted hand. We provide them LN for artificial limb, Jaipur foot also in free of cost. We have serving for the tribal people in Nandurbar district who is suffering from sickle cell anemia. We are providing the medicines and other nutritional foods also for the needy people. We have the hospital has NABH and ISO ranking 9,000 to 15,000 also. We are serving all facilities like ICU, NICU, and other also ortho surgery also. We have the bed intake bed capacity is the 300. So I received this award. So I would like to thanks to Dynergic Business Solutions. Thank you very much. It is a great responsibility to serve the nation and society. So this award is motivated to us. Thank you very much.
Thank you so much, sir. And now the other category that we have is award for Most Trusted Robotic and Minimally Invasive Cardiac Surgeon in Bengaluru. And the award goes to Dr. T. Kumaran Mangalam, Senior Consultant, Narayana Health. Sorry, sir.
Hi, thank you. I am Dr. Kumran Mangalam, Senior Consultant, Minimally Invasive and Cardiac Surgeon, Narayan Health, Bangalore. Thank you for the Golden Main Awards Conference for selecting me for this most award. And just to tell a few about the minimally invasive and the robotic cardiac surgery. So the minimally invasive and robotic cardiac surgery is what we do in the conventional method by opening the sternum, and inside what we do is the same in robotic and the conventional. Only thing is the approach is different. So the advantages of doing the robotic or minimally invasive is the advantage for the patient. The patient can get discharged from hospital in a couple of days. They can go and they resume their daily activities in a couple of weeks. So as sir told in the beginning that artificial intelligence, it's like augmented intelligence. The faster we catch up to the advanced technology, and the faster we can grow with it, and the faster and more advantages we can give it to our patients. Yeah. Thank you all.
Thank you so much, sir. You both can have a seat, and thank you for doing the honors. We still have a few set of awards to give away, but then those people are not here with us. They'll be joining us virtually on the screen. But before that, I would like to call everyone on the stage for a group picture. Please join us with their awards and trophies. A winning smile on the face, please.
Hold. Smile cannot be artificial.
It means you're not happy. एक और award, please, sir. Go.
दो चीज कभी artificial नहीं होती. Wait. Hold up.
We have high tea arranged for you. Bar counter pe you guys can go and have it. But we still have a few set of awards to give. Okay, so now we have our awardees who are joining live with us virtually on the Zoom meeting platform. The first category that we have is Most Trusted Pediatric Orthopedic Surgeon in Mumbai, and the award goes to Dr. Avi Pranay Shah, MS Ortho, FPO, India, USA, UK, NH SRCC Children's Hospital, Mumbai. Please give him a huge round of applause.
Many congratulations, Doctor. We request you to please share a few words with us. Nine. So we request you to please unmute yourself. We'll move on with the next award.
Okay, so the next category that we have is Best Neuro and Spine Surgeon in Bengaluru. And the award goes to Dr. Umesh Shrikant, Additional Director, Neurosurgery and Clinical Lead, Spine Surgery, Fortis Hospital, Benerghatta Road. Would like to request you, sir, to say a few words on your winning.
Many congratulations, Doctor. We'll move on with the next award.
Okay, the third category that we have is Most Trusted Diabetologist in East India, and the award goes to Dr. Suranjit Kumar Patra, Consultant Diabetologist, Apollo Sugar Clinics, Bhubaneswar. Congratulations, Doctor. I guess he is there. I would like to request Suranjit sir to say a few words on your victory.
Thank you, Team Golden Aim and Awards. Thank you everyone for providing this opportunity to get this award, and I would like to continue this work in future also. Regarding diabetology or regarding diabetes, My main point is to increase the public awareness about lifestyle management. Lifestyle management is the most important thing: diet, exercise, stress management, sleep hygiene. Medicines are part of treatment, not the major part. The major part is lifestyle management. And ABC, that is the main mantra of diabetes care. ABC, A for A1C, B for blood pressure, and C for cholesterol. There is a proper goal of ABC for every individual with type 2 diabetes mainly. Diabetes management is individualized. That is the most important thing, individualized. Okay, so ABC, know your ABC, take care of your ABC, keep your ABC under good control, and ultimate goal of diabetes management is to prevent the complications of diabetes. Okay, so that is the whole point I would like to emphasize here. Thank you Golden Aim team and everyone for providing me this opportunity and this award for most trusted diabetologist. Thank you very much.
Thank you, Saranjeet sir, for your valuable words. Now moving to the next award, the next category is Most Trusted Pediatrician and Neonatologist in Kolhapur, and the award goes to Dr. Vijay Kashinath Gavde, Neonatologist and Pediatrician, Sai Sparsh Children Hospital, Kolhapur, Maharashtra.
Hello.
Hello. Many congratulations, sir.
Thank you very much.
So we request if you can share a few words with us.
Sure, definitely. First of all, I would like to thank Golden Aim for this appreciation. We at Saispur Children's Hospital, we are like 80-bedded dedicated pediatric hospital at Kolhapur with the 40-bedded NICU, and we have team of 10 intensivists in at one place. And we do transport up to 250 kilometers, and we are transporting small, tiny, like 700, 800 grams baby also from different places, and we are treating here. Apart from that, we have like pediatric surgery backup, then pediatric ICU backup with hemodialysis. So as a team, we are giving almost 95% results, which are matching to the international standards. So thank you for this award, and with this appreciation, again, we get boost to work more hard and save more babies. Thank you.
Thank you so much, sir. Please give him a huge round of applause, everyone.
Thank you.
Okay, so moving towards the next award, and the next category is Visionary Pharma Leader in India, and the award goes to Mr. Arun Sriram Sehgal, Chairman and Managing Director, Kempro Pharma Private Limited. So if you're there and listening to us, please share a few words.
Many congratulations, doctor. We'll move on with the next award.
All right. The next category that we have is Most Trusted Liver Transplant and HPB Surgeon in Hyderabad. And the award goes to Dr. Mohammad Abdul Naeem, Chief Liver Transplant and HPV Surgeon, Yashoda Hospital, Secunderabad.
Many congratulations, doctor.
Please say a few words on your victory.
We'll move on.
Okay, moving towards the next category, Most Trusted Nephrologist in South India, and the award goes to Dr. Bijoy Antony, Senior Consultant and Professor of Nephrology, Aster MIMS Hospital, Kannur. Congratulations, sir. Please share a few words with us. I guess he's not here. Moving forward to the next category, Most Trusted Pulmonologist in Odisha, and the award goes to Dr. Jyoti Patnaik, former professor, Department of Respiratory Medicine, SCB Medical College, Cuttack, Odisha. Congratulations, doctor. I guess she's also not there. Moving forward to the next category that we have, Most Dynamic Critical Care Medicine Specialist in Mumbai, and the award goes to Dr. Rishi Kumar, Consultant Critical Care Medicine and Physician, PD National Hospital and MRC. Congratulations, doctor. He's also not there, so moving forward with the most trusted mental health specialist in Bengaluru, and the award goes to Dr. Diksha Avasthi, founder Diksha Life. Congratulations, Dr. Diksha. She's also not there, so we are moving forward again. The next category that we have is Excellency Award in the Healthcare in Vascular Surgery in India, and the award goes to Dr. S.A. Hussain, former professor and HOD of Department Vascular Surgery, Institute of Vascular Surgery, Madras Medical College and GGH, Chennai. Congratulations, doctor. The next category that we have is Healthcare Excellence Award in Robotic Transplant Surgeon, and the award goes to Dr. Sri Harsha Harinatha, Director and Lead Consultant, Urology, Robotic Surgery and Renal Transplant, KIMS Hospitals, Bengaluru. Congratulations, Dr. Sri Harsha. Moving forward to the next category, Women Healthcare Excellence Award, and the award goes to Dr. Ratna Chopra, Head of Department of Surgery, NDMC Medical College and Hindu Rao Hospital, Delhi. Congratulations, doctor. The other category that we have is Most Trusted Healthcare Leadership Award, Physics, and the award goes to Dr. K.R. Murlidhar, Director of Physics, Karkinos Healthcare Private Limited. I guess doctor is not here. Congratulations, doctor. The other category that we have is Most Trusted Hematologist and BMT Physician in Hyderabad, and the award goes to Dr. Karuna Kumar K, Consultant Hematologist and Bone Marrow Transplant Physician, Dr. KK Hematology Care. Congratulations, doctor. The other category that we have is Gastrointestinal and Minimal Access Surgery, and the award goes to Dr. Usman Shabir Ahmed, Senior Consultant in General Gastrointestinal Surgery, Robotic Surgery, Fortis Hospital, Banarghatta Road, Bangalore. Congratulations, doctor. I guess he's also not there. Award. The next category that we have is Award for Most Dynamic Cardiovascular and Thoracic Surgeon in Kerala, and the award goes to Dr. Deenraj TB, Robotic and Minimally Thoracic Surgeon, Aster MIMS Hospital, Kozhikode. The other category that we have is Most Innovative Women Leadership Award, Healthcare Technologist, and the award goes to Swati Gopala Krishna Shetty, Clinical and Health Product Analyst in Phoenix. Congratulations, doctor. The other category that we have is for Excellence in Leadership Technology and Cyber Security, and the subcategory is Exemplary Women Leader Award, Technology and Cyber Security. The award goes to Lakshmi Vasudha Kota, Cyber Security Audit Manager, Cloudflare. Congratulations, ma'am. The other category is for Excellence in Leadership in Education, and the subcategory, yes? Okay. So we have a video from Lakshmi Vasudha Kota ma'am, Cyber Security Audit Manager, Cloudflare.
Good evening, everyone. To the Golden Aim Awards Committee, the distinguished judges, and my fellow nominees, thank you. Sitting here tonight, I am filled with an overwhelming sense of gratitude. Receiving the Exemplary Women Leader Award in the Technology and Cybersecurity category is not just a personal milestone. It is a testament to the collective resilience of women in this high-stakes industry. When I started my career in technology and cybersecurity audit a decade ago, the landscape looked very different. For 10 years, I have navigated the intricate world of risk, compliance, governance, and digital defense. In audit, we are often seen as the checkers or the gatekeepers, but I've always viewed our role differently. We are the architects of trust. This award carries the title Exemplary Women Leader, and that is the responsibility I do not take lightly. Cybersecurity is a field where women are still underrepresented, yet our perspectives are vital. Diversity isn't a checkbox, it is a security imperative. We need different ways of thinking to stay ahead of evolving threats. To the young women entering this field today, your voice is your greatest asset. Do not just look for a seat at the table. Help build a bigger table. To my mentors, my colleagues, and my family, thank you for being a firewall against doubt and my aspiration for growth. In the world where technology moves at the light of speed, let us ensure our integrity moves even faster. Let's continue to lead with empathy, innovate with caution, and protect with passion. Thank you again for this incredible honor. Here's to the next decade of making the digital world a safer place for everyone. Thank you.
Thank you so much, Lakshmi ma'am. All right, the other category that we have is Lifetime Achievement Award in Education Sector, and the award goes to Dr. Puspita Das, Professor and Head, Department of Extension Education and Communication Management, College of Community Science, Central Agricultural University, Tura, Meghalaya. Congratulations, ma'am. Okay. Moving forward to the next award category, and that is Institution Builder and System Innovator Award, and the award goes to Mr. Rakesh Singh Tomar, Director, Oasis Scenic School, Full Residential Co-ed School. Sir is also not there. Okay, so everyone, let's give a massive round of applause to the leaders who inspire excellence, and also for those who were not there. As we conclude the Golden Aim Conference and Awards for Excellence in Leadership, I want to take a moment to express my heartfelt gratitude to all our supporting partners. A special thank you goes to Dr. Farheen Khan, co-founder and CFO of Golden Aim Awards, Ms. Farheen Syed, Director of Golden Aim Awards, and Mr. Azharuddin Farooqi, CEO, Dynergic Business Solutions, whose unwavering support has been invaluable in the success of this event. I also want to acknowledge all the esteemed participants who took the time to join us today, as well as the remarkable award winners. The dedication and hard work of yours are truly recommendable. For your dedication and hard work are truly commendable. For our award winners, please note that you can expect to receive your event photographs and video within the next 3 to 4 working days. So you can proudly share this milestone with your professional network. I would like to encourage all delegates and participants to engage with us on social media by liking, sharing, and subscribing to our official Golden Aim Awards YouTube channel. Your support helps us reach a wider audience and promote the incredible talent we celebrate today. Yeah. Thank you once again for being a part of this event. Your presence has made it a wonderful experience. Goodbye, and I look forward to seeing you at your future events. Okay, we have Dr. Dinraj with us, and the category is Award for Most Dynamic Cardiovascular and Thoracic Surgeon in Kerala, and the award goes to Dr. Dinraj TV, Robotic and Minimally Thoracic Surgeon, Aster MIMS Hospital, Kozhikode. So please say a few words. Congratulations, sir.
Hi.
Hi.
Thank you for giving me the opportunity to accept this award. I'm really sorry to join very late because of an emergency.
No problem.
It's a great privilege to be selected as selected for this award. I am working for last 3 years as a thoracic surgeon. Even though I'm a cardiothoracic surgeon, I am focusing on my special interest in thoracic surgery. So I want to develop this specialty as an independent specialty. So I'm very happy to be selected as the award winner. Thank you.
Thank you so much, sir. Congratulations. And please give him a huge round of applause, everyone. And with this, I, Megha Kedia, your host for the day, is signing off. Thank you so much for being a wonderful, wonderful audience. Thank you. Hope to see you soon in the future event.